Hi, my name's Kia, I'm a mum midwife and I want to talk today about postpartum mental health. So when we have a baby, there is a huge shift in our hormones. There's a big drop in progesterone and estrogen, which causes us to feel so unsettled. We can feel overwhelmed, angry, tired, emotional, sluggish, and this is just a transitional stage with our hormones until they settle out. You may have heard this stage being referred to as the baby blues. It usually lasts a few days to a couple of weeks, and that's completely normal to feel like that. If you feel like these symptoms are prolonging longer than that period, that may be a sign that you just need a little bit more support with that. So I just want to give you a little bit of an overview of different illnesses and the different symptoms that you need to be looking out for. And to be honest, there is quite a lot of crossover between these symptoms. The main thing is that these symptoms are recognised and you're getting the support you need, and you're just recognising if them symptoms are lasting a little bit longer than what is normal. The first condition I want to talk about is postnatal depression. So 1 in 10 women experience postnatal depression, and actually 1 in 25 partners experience this as well. So it's really important that you have an awareness of this and an awareness of what the symptoms include. So the biggest misconception of postnatal depression is that it only displays in feeling sad, low, not bonding with your baby. And although they are all symptoms of it, it comes along with a lot of other symptoms as well. So low energy, fatigue, struggling to sleep, struggling to make decisions, struggling to concentrate on a daily basis, struggling to settle on a daily basis. If you feel like you're getting any of them symptoms and they're lasting a lot longer than the 2-week period, this is a sign that you might just need to get some support or speak to someone about that. So the next condition I wanted to highlight is postnatal anxiety. Now this is a lot more common than postnatal depression, but I don't feel like it's talked about as much. Postnatal anxiety can happen anytime from birth, but symptoms usually peak around about the 3 to 6 month mark after having a baby. So symptoms include constant worrying usually around your baby's health and well-being. You can get constant tension, muscle ache, headaches. You can struggle to sleep. You can get dizziness, panic attacks. Usually it's just a feeling of being unable to settle, and you constantly feel like your mind is racing, you're thinking about so much stuff all of the time, and you just struggle to switch that off. Another condition that has a lot of symptoms that are quite similar to postnatal anxiety is postnatal OCD, which is obsessive compulsive disorder. So this can happen anytime from birth up until a year after giving birth. Symptoms of this include compulsive repetitive behaviours such as excessive cleaning, excessively checking on your baby, intrusive thoughts, so imagining something bad's going to happen to your baby. Sometimes people feel a fear of being left alone with the baby in case something bad happens. Generally just a feeling of unsettledness, that they can't settle, they can't switch off, and this lasts over the 2-week period. If you find that you're getting any of them symptoms, then that might just be a sign that you need further support with that. Another thing that some women can experience is postpartum PTSD, which is post-traumatic stress disorder. Now, this is normally related or triggered by a traumatic birth experience that manifests, and symptoms usually come out within the first few months of having a baby. However, symptoms can come out a lot later than that if a birth experience hasn't been processed or addressed at the time. This can come out a lot later, and symptoms can arise a few months down the line. So symptoms of postpartum PTSD, people can experience flashbacks of their childbirth experience. They can find themselves avoiding certain situations because it reminds them of that time. Emotional numbness or detachment from your baby. And just another one that generally you can't settle and you have this constant feeling of being on edge. So the last condition I wanted to highlight is postpartum psychosis. Now this is a lot less common than the other illnesses. 1 to 2 in 1,000 women will experience this, but the symptoms are quite serious. This includes hallucinations, so seeing and hearing things that aren't really there, delusions, so false beliefs, extreme mood swings or confusion, disorganized thinking or behaviours. If you feel like you are doing any of these things, or you're aware of them, or if you think that your partner is displaying any of these symptoms, then definitely speak to someone and get some support in place for that. So treatment for any of the symptoms we've discussed will vary upon the individual and their circumstances and what they've got going on, how much support they actually need. The treatment can range from talking therapies to medication. The main thing is, if you're experiencing any of these symptoms, or if you're struggling with any of the above symptoms, for a longer period than what is classed as normal, you speak to someone. So whether that's your family, your friends, your peers, speak to medical professionals. So midwives, GPs, health visitors, the perinatal mental health services, which are amazing. Just speak to someone sooner rather than later, and the outcomes of getting that support in early are a lot better. I hope you found this video helpful. Please reach out to health professionals if you've got any concerns with mental health at all in the postnatal period. Having a baby is one of the most amazing experiences, but it's so important to take care of mum's wellbeing too. Do check out my other videos here on the Kendamil channel on postnatal care.